For some, stress can be more mentally and emotionally debilitating. And aside from mental health issues such as anxiety or depression, too much stress can lead to some serious physical issues as well.
I feel like just body soreness, getting up, like mental fatigue.
Manny Costa isn't talking about the flu.
I'm under a lot of stress.
He's an in-demand customer service engineer for Mount Sinai and is taking part in a study there about how stress impacts the cardiovascular system.
Although we have great tools in terms of treating cardiovascular disease, either with medication, lifestyle behavior, or intervention, it still remains something to worry about.
Dr. Sahi Fayyad is a Mount Sinai professor working on the study who says cardiovascular disease is the #1 killer in the U.S. Central to the study, how does stress impact that?
Leads to depression, anxiety, and other sequelae that comes out of it. But what has not been very well understood is there a link between what happens in your brain and what happens to the rest of the organ.
Along with scientists and neuroimaging expert David O'Connor, Dr. Fayyad illustrates the impacts of stress on the brain and cardiovascular system.
As you get stressed, you activate certain area in your brain. The immune system gets elevated. Now we have really bad actors in our body. These bad actors are going to trigger a heart attack and a stroke.
O'Connor adds that for someone who is chronically stressed, there can be a breakdown of communication in parts of the brain, and that can ultimately lead to a narrowing in the cardiovascular system.
You ideally would have like a perfect circle, but you see these kind of indents, and that's basically plaque buildup, right? And so that's one of the key endpoints we have for the cardiovascular disease.
We saw hot spots in the brain. We saw illumination of your vasculature with inflammation. So we see the fire. We did demonstrate in chronic stress people that they also have a high level of inflammation and high level of cardiovascular disease.
And Dr. Fayyad says he's also shared these important findings with his fellow doctors.
My cardiology colleagues, they are asking about stress, part of their initial visit with a patient.
After being in the study, I was thinking about stress more. Just whether it's taking deep breaths or just relaxing, listen to music, whatever it takes, you just do a reset.
Cindy Hsu, CBS News, New York.
Cindy covers mental health. For all of her reports breaking the stigma, head to our website, cbsnewyork.com.